Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about rhinoplasty. Do I need to have general anesthesia to have rhinoplasty? Well, in answering this question, what we'll do is we'll talk about the different types of anesthesia, what are the advantages and disadvantages of these types of anesthetic, and what is going to be ideal for your individual circumstances. My name is Dr. Julian De Silva, and I'm a London-based facial, cosmetic and plastic surgeon, and rhinoplasty is one of the commonest procedures I complete for my patients every week. So in answering this question, what are the different types of anesthesia? Well, general anesthetic is the commonest form of anesthetic that is used for rhinoplasty, and this means that you are unconscious during the procedure, and machines are used to regulate your breathing. This does mean that there is a breathing tube down your throat during the surgery, so often your throat can feel quite sore afterwards. And because you're unconscious, generally the recovery period is a period of hours, which can often mean that you stay in hospital overnight after having general anesthetic. About a third of patients describe having feelings of nausea or sickness after general anesthetic, and this is really a side effect of the general anesthetic. Other things that patients can often worry about, well, will I wake up after general anesthetic is a common concern, and general anesthetic, generally speaking, is a very safe form of anesthesia, and it would be very rare for something like that untoward to happen, but many patients are concerned by that. Very rarely with general anesthetic you can have a clot occur in your legs, and this is sometimes termed a deep vein thrombosis, and preventative measures are taken during the procedure in order to avoid that. Generally speaking, general anesthetic is a very safe form of anesthetic, but often patients have had previous experiences of general anesthetic which may be less favorable. Another form of anesthesia is sedation anesthesia or twilight anesthesia, and this is commonly used in the US, and this means that you're essentially sleeping during your surgery. And so with sedation anesthesia, you are breathing yourself, your natural protective reflexes are protecting yourself, but you are sleeping just like you sleep at night, but it is just brought on with medicines. And common concerns patients have, well, will I be awake during the surgery? Well, by definition, in sedation, you are conscious because you're breathing yourself, but generally you are sleeping and you are comfortable and relaxed and you are sleeping like you would do at night. The advantages of sedation, well, sedation, because you're only sleeping, doesn't take nearly so much out of you as general anesthetic when you wake up and recover. And with sedation, generally you wake up over about 30 minutes, and after 30 minutes you can go home. And so you don't need to stay in hospital overnight. All patients are able to go home on the same day. And other side effects, well, patients don't have the same level of having a sore throat because there's no breathing tube down your throat. Patients, the chance of having things like nausea or sickness is much less than 2%. So overall, with sedation anesthesia in comparison with general anesthetic, the recovery is faster and smoother and doesn't take quite so much out of you. The other type of anesthetic that is worth mentioning is local anesthetic, and certainly if you have a focal area, such as if you needed some dental treatment or if you had a little lesion on your face that needed removing, local anesthetic means numbing agent is put into that very focal area and that area can be treated. It is challenging to do that with rhinoplasty because your nose is a sensitive area of the face, and to be fully awake over a rhinoplasty surgery is really not a comfortable experience, and I would certainly recommend having general anesthetic or sedation anesthesia because really local anesthetic is not that suitable. So in terms of the different types of anesthetic, what is most suitable for you? Well, to some extent, this will be determined by what is required during your surgery. And some kinds of surgery, like more graft material that might be required for certain revision rhinoplasties, well, these may require certain types of anesthetic in order to treat you. Other factors are your general health. Some patients with other medical factors may be less suitable for general anesthesia because sedation anesthesia is milder and may be safer. Overall, the personal circumstances that you have require individual choice, and you may choose to have a different type of anesthetic depending on what you feel comfortable with. Most surgeons also have a preference for a type of anesthetic, and certainly in the UK there is more of a culture towards having general anesthetic, and general anesthetic is a safe form of anesthetic. However, it does tend to have longer recovery compared to sedation anesthesia. My personal choice for patients, having used general anesthetic for many years and now using sedation anesthesia, I find that most patients have a smoother journey and faster recovery with sedation anesthesia, and so for the majority of my patients I treat with sedation anesthesia. I ask every single patient, how was your experience and what could be improved? And certainly patients who've had previous general anesthetic and I've given sedation to have a preference towards sedation anesthesia. So in summary, today we've talked about the different types of anesthetic, what it means to have general anesthetic, what it means to have sedation anesthesia, what are the advantages and disadvantages of those different types of anesthesia, and we've talked about what might be most suitable for you. I hope this information has been useful for you. Thank you for watching.